Between 20 to 40% of women suffer of a condition that they so embarrassed to speak about, they so embarrassed to express to their loved ones and even their doctors. They suffer in silence. If you're one of them, listen up. This condition called urinary incontinence. And you would think urinary incontinence is not that prevalent. It's actually very prevalent. It's a stress incontinence we're talking about, when the patient coughs and sneezes and she leaks. So if you have any of those symptoms, that is called stress incontinence. When you exercise, when you jump, when you cough, when you sneeze and you pee, it's incontinence. If you're still menstruating, your body still can hold it. But then once you start hitting perimenopause and menopause, especially after menopause, what happens with the vaginal and bladder area becomes the mucosa, the lining of that area becomes thinner, and symptoms get worse. If you have that condition, you have to address it now. There may be many reasons for that. It could be infection, it could be estrogen deficiency, it could be trauma to a vaginal canal during childbirth. It could be so many other reasons. So when you go to your doctor, when you talk about it, most of the time they send you to a urologist. The urologist performs tests called urodynamics to really establish that diagnosis, because there are so many other types of urinary incontinence. Once the diagnosis is established, this is when the treatment begins, offering, so to speak, of the treatment. Unfortunately, because urinary incontinence is not a life-threatening condition, we don't have that many options to treat. It's medication. We're talking about something that's covered by insurance. It will be medication, and medication doesn't work. It's surgery, and surgery is not always the answer as well. If you go beyond insurance, yes, there are some procedures, but very expensive. Some radiofrequency procedures, laser procedures that they're very expensive. So the cheapest one, and by the way, very, very effective today that we have on the market, and in my practice, I feel like this is the most effective, is some modality named acoustic wave therapy. So the most effective and the cheapest, I would say, is acoustic wave therapy. So we do have in our practice, just in case if you're in New York area, the name of the practice, Central Park Medical. You can find us 134 West 58th Street, between 6th and 7th Avenue, New York, New York. So you could look it up and call us and make an appointment. But it's much cheaper than any other modalities, but it's very effective. But in my protocol, it's not only that makes it work. I also use, besides acoustic wave therapy, I use direct injections in the vagina with PRP. If I'm in New York, we also have location in Palm Beach. If we're in Palm Beach, then I can give you exosomes or stem cells, because that is legal in Palm Beach and illegal in New York. But in New York, you can get PRP. But it's very, very effective. And on top of that, I always recommend to use pumpkin seed oil. Pumpkin seed oil, it's a part of my protocol for urinary incontinence. Considering that you went through the whole diagnosis, you really have a diagnosis of stress incontinence, then this treatment works. And the best candidate for that are women who are not menopausal yet. If you hit menopause, it's still going to be effective. You're probably going to have more treatments. But younger girls, they respond so well, so quick. And most of the time, they need 2, maximum 3 treatments. So do your research, check it out. And if you need any help, let me know.